Hey, what's up everybody? Are you one of hundreds of millions of people who suffer from low back pain? Well, pay attention today. We're going to be talking about low back pain, the causes, common treatments, and what you can do so that you're not one of those statistics. I'm Dr. Ryan Weaver here at Apex Spine and Performance. Today, our spinal workshop topic is going to dive into this about the next 8 to 10 minutes of the most common things that you should know about low back pain. So, before we get started, our spinal workshops, we do these varying topics. This whole month of February, we're doing a lot of common conditions that we see in our office and in chiropractic care and in healthcare, really globally. So do us a favor, go ahead, subscribe to our YouTube channel, follow us on Facebook, like us, share this, post it, ask if there's anything that you would like to specifically see. We try to keep these always very relevant to current times. So diving into this spinal workshop of low back pain, you heard me mention hundreds of millions of people suffer from low back pain. In 2022, 619 million people globally, and it's estimated that the number will increase to 843 million cases of low back pain by the year 2050. This is largely due to population expansion and aging. And of these 619 million people who live with low back pain, it is the leading cause of disability worldwide. So I've had the pleasure of working with many companies in our area, and one of the most common things that we talk about is such as low back pain, and from a financial and a productivity standpoint, the burden that creates. Low back pain is a major public health issue and is often associated with the aforementioned loss of work productivity, produces a huge economic burden on individuals and societies that is sourced from the World Health Organization. And low back pain is the single leading cause of disability worldwide. It is estimated that 84% of adults will have low back pain at some point in their lives. So, the other statistic there is it's one of the most common leading causes of ER visits as well. So how does this all happen? What is something that you can do to prevent these things? Well, number one, we know that movement is the key to life. Movement is a good thing, exercising and moving. You know, one of the things we talk about all the time in our office, because 75% of Americans set for a career, is things that you can create in your workplace. A standing desk, walking, I think they're called walking boards, or I call them walking treadmills that you can put under your desk. These little active things, little 10-minute walks, frequent breaks, these are easy movement things that you can do that is going to keep you from sitting all day, which we know those abnormal postures, because not many of us when we do sit actually sit correctly, myself included sometimes. If we slouch, if we hunch over, not just for our lower back, our upper back, and our cervical, our neck, spine as well. So, being active, moving around, always being a physically fit and active person as well. Those are easy things that you can do. Some other causes that you may hear which can create low back pain. Arthritis of the spine. Again, this is just not low back pain, but the whole spine. This is from Johns Hopkins. Arthritis of the spine, the slow degeneration of spinal joints, is the most frequent cause of lower back pain. All of us experience wear and tear as we age, and it is normal for your lower back to start acting up as you get older, as the cartilage breaks down between the spinal joints, surrounding tissues, which may become inflamed. The inflammation and thinning of the cartilage increases friction in the joints, which may cause lower back pain. So, hearing that, the wear and tear, in my opinion, it's abnormal wear and tear. We have wear and tear all the time, but it's abnormal when our spine is not where it should be. If you're deadlifting inappropriately, you're putting your back at risk for easy injuries, disc injuries, herniation, bulges, but long-term things like osteoarthritis, degenerative joint, and disc disease. So these are all things that kind of get grouped together, and you hear them a lot interchangeably. So things to know about that: if you take care of your spine, it should last you a lifetime. Research has said, your spine has the ability to last 100 to 125 years before it should start to decay. So it is possible as long as we take care of it. Some of the other causes, or etiologies, excuse me: traumatic, degenerative, cancerous, infectious, inflammatory, metabolic, referred pain, postural, congenital, and psychiatric. These are all possible causes of lower back pain. Another study, Scandinavian study. This is how early we start to notice younger folks having lower back pain. Age 18 for female and age 20 for male, 50% would have experienced one episode of low back pain by those respected ages. Again, 18 and 20-year-olds having low back pain, that should never, in my opinion, be on the board. And I'm not talking about the exceptions, a traumatic event or something like that. Another research study from JAMA in 2018. The study was 750 active military participants over a 6-week trial. They split that down the middle. Half received medicine, physical therapy, and self-care. The other half included that, but also adding in chiropractic adjustments. The conclusion of that study: with chiropractic care, less pain intensity, less disability, more improvement, function, higher satisfaction with the treatment, and less medication needed. So, as you know, I always bring up common treatments and then also the conservative treatments as well. So these are kind of mixed in here interchangeably, but most commonly you would see muscle relaxers, opioids, physical therapy, steroids, and NSAIDs. Other less strenuous treatments: massage, acupuncture, heat, spinal manipulation or spinal adjustments as we call them, traction, and exercise. So I'm going to come up with one of these anticonvulsants here that you probably have actually heard of before and maybe weren't aware that it was an anticonvulsant, but they use in the common treatment of low back pain. The role of anticonvulsants like gabapentin and in managing low back pain is uncertain. Transcutaneous electric nerve stimulations, known as TENS units, do not appear more effective than placebo in managing chronic low back pain. The American Pain Society recommends that surgical referral be reserved for patients with disabling low back pain lasting longer than a year. However, evidence is mixed for some of the most commonly performed invasive procedures, including epidural space injections, therapy, and lumbar disc replacement. So, even the American Pain Society, other surgeons, that surgery should be a last resort. Other things that you can do: natural anti-inflammatories such as curcuplex, curcumin, turmeric. Again, we've talked about regular exercise and training slows degeneration, improves bone density, muscular recruitment and development, and also balance as well. All those things improve if you do them. And of course, again, chiropractic care and adjustments. The better that we can keep our spine in the correct alignment for a long period of time, all aspects of health can have the potential to improve. Lower back pain, musculoskeletal pains, of course, are some of those, to mention a few. So I hope you found some of this informational, some of this educational and good information for you. Next week, we'll be doing another spinal workshop topic involving common symptoms, treatments for conditions. I'll leave that one for you to figure out and join us again next week. So we look forward to seeing you. Thank you again. Subscribe to our YouTube channel, like us on Facebook. We'll look forward to seeing you at our next spinal workshop.